Thank you so much for your patience, and we're so glad that you're here. See a lot of friends and a lot of familiar names here, and we're really happy that you're here. Today, we are going to be talking about reshaping the healthcare staffing landscape. Embracing digital transformation is a huge part of this to solve problems in healthcare, to get more efficient. And essentially, when we look at what we do in the staffing and recruiting industry, regardless of vertical, is we reduce the friction from finding great jobs for great people. So how do we do that in the shortest amount of time? And a lot of that is through the proper utilization of technology. So I'm really excited about our conversation today. And as soon as Michael joins us, we are going to get started. I'm so excited to have this fireside chat with you and with Michael. There he is. And so let's introduce the two of you. So my name is Lauren Jones. I am the founder of Leap Consulting Solutions. We've just gone through a merge with Newberry Partners, so I'm not really sure how to introduce myself yet. I'll find my script as soon as I'll find my script somewhere in the next couple weeks so I can introduce myself properly. I've been in the industry for a little over 26 years in almost every vertical. And one of my favorite things to do is talk with other experts and leaders in the industry about how we really solve problems. My biggest goal in leaving a legacy in this industry is to really help solve problems and help connect great people with great jobs through the responsible utilization of technology and digital transformation. So it brings me great pleasure to introduce Candace Klaus. Let me tell you a little bit about Candace. Candace is a native of Dubois. Did I say that right, Candace? Dubois.
It's Du Bois. Du Bois,
Du Bois. Okay, so
Nebraska.
I went the French route. I went the fancy route.
I like Dubois better though.
You like Dubois better? Okay. A small rural town in Nebraska. She stands as a visionary CEO and founder of a thriving women-owned business. Go. Her leadership is characterized by prioritizing her team's growth and well-being, valuing input, and fostering a culture of inclusivity and innovation. Under her guidance, the company earned the WBENC certification and multiple industry awards, cementing its position as a top healthcare staffing firm. Candace's commitment to excellence and calculated risk-taking has garnered respect from peers and made her a role model for women in business and fellow female entrepreneurs. Beyond her professional success, she actively engages in community and industry DE&I initiatives, using her achievements to create a positive impact and inspire others. We're so happy to have you, Candace. Thank you for being here.
Thank you, Lauren. I appreciate it.
Yes, absolutely. Michael. Okay, Michael. Tell me that last name. Tell everybody how you say it.
Well, that name is actually French, so you might be right if you tried, but it's Jacateau.
So, okay. All right. I buy that for $1. Michael Jacatel founded Aspire in 2013 and has been the agency's managing partner since inception. Michael was named by SIAs as a 40 under 40 executive in 2017 and led Spire to Inc. 500 and Pacesetter Awards as one of the fastest growing companies in the country. As of 2003, Spire was recently named #2 fastest growing by SIA with a 1,600% plus compounded annual growth rate. Holy Hannah banana. Spire has a niche focus on RN and allied recruitment at large hospitals and healthcare systems throughout the Southeast and Mid-Atlantic regions. Michael, thank you so much for joining us. I could not be more excited about this conversation today. So you both have been faced with challenges. I think healthcare, pre-COVID, post-COVID, two totally different worlds. Let's talk about the business challenges that you faced, particularly with such growth. Both of you have fast-growing firms. So what I want our listeners to walk away with today are some tangible takeaways. What can they be doing to help reach some of the lofty achievements you both have reached, but doing it through the leveraging of technology? And so let's talk about some of the challenges that you were both faced with. Candace, we'll start with you, but let's talk about specifically what some of those challenges were that you faced, and tell our listeners what steps you took to really understand and maybe break down those challenges.
Well, I think, with fast growth, one thing that's interesting is, we are with Marble, we had experts regarding, the staffing, but when it came to automation, technology, we really had a huge gap there, especially with our growth. So that was a huge challenge that I saw, because I think probably anybody listening today, our goal, right, especially in our roles, is to make our team more efficient. It's giving them the ability to focus, excuse me, to focus what they are good at. And so like I said, we had a huge gap there. And then it was a gap too with our end users, right? Our customers and our clients, our clinicians, especially, we were very, I'll use the term old school, in a matter of like, how could they access, like, getting us documents? It was through email. Our compliance team was email after email trying to collect documents, and it was like, how are we making our clinicians more satisfied through the process? So there are a lot of gaps there that we needed to streamline in order for us to be more efficient. And when you have those gaps and they're not coming out of one technology or software platform, then it's really hard to determine, right, what data is giving you a result, right? Like, you take one specific recruiter and it's really hard to gauge, like, what metrics are they hitting? What KPIs, right, can we compare, especially if it's a high performer? What are they doing that we can bring to the table to the rest of our organization and teach and coach the rest of the team, and lead that into training? So those were a lot of huge holes and gaps that we had, that I think in order to really build for our future, that's our theme this year, those were things that we really had to solve going into 2024.
So if I heard you correctly, you have a gap on focus and efficiency. You had an experience gap with your clinicians and your customers. You had too many technologies going too many different directions at the same time, at the different time, just kind of all over the place. So I always say there is no transformation without integration. So if they're not integrated, that can compromise experience, right?
Yeah, I can't. Yes, you touched on a point there too that was very specific. When I took over our business enablement team and was looking at it all, overall, we had so many different platforms to plug in, but we weren't even using them effectively or efficiently. So it was a direct hit to our bottom line of over expenditure, not understanding the value of the technology. So, that was a part of we got to figure out, what is the solution to this? What do we need to do to move forward? Because we could not operate continuously in that way. And if we had done that, it would have been extremely disruptive to our business. It would have hurt our bottom. I mean, it could have broke us. So that was a huge, huge problem.
And I will tell our listeners, as we come into 2024, optimization of current technology seems to be a theme. Let's use what we have. But the thing that we've uncovered as we go through technical audits is tech bloat. So much duplicativeness and all of this. So you're 100% right. And the other two things I heard you say was identifying metrics that matter, and then training and adoption, right? We got to utilize what we have. And so those are 5 areas that I see as a consultant or an advisor consistently across the board. We need to provide focus and efficiency. We've got to have a great experience for clinicians and customers. We've got to integrate. We got to have metrics that matter, and we got to have good training and adoption. It all seems so simple when you just put it in a list like that, doesn't it? And Michael, tell me, from your perspective, what your organization that's had a 1,600% plus increase, that's bananas, what your challenges were.
Yeah, absolutely. So, the world changed with COVID in our business, and I think a lot of folks on this call were like me. They're watching the change happen quickly. As Candace said, we were old school too. I think that's how a lot of how recruitment companies looked at themselves before COVID, as like kind of BC, like truly before COVID, and how you could compete. And then COVID happened, and when there was the amount of growth in the industry, a lot of investment dollars were recycled back into digital platforms. And to keep up, you had to look into it, and you could no longer be old school. You could no longer just kind of resolve yourself to being able to just compete the way you did in the past. And so that was the biggest challenge for us, is while we were growing, we saw it changing in front of our eyes. And this change has actually accelerated, in my opinion, in the last couple of years, and continues to do so. And so we had to, as an organization, still take care of our customers and candidates, because if you just kind of reduce it to the basics, that's all we have: two sets of customers, clients, our facilities, and then our talent, our candidates. And how can we do more, better, faster with them? And it's a constant struggle. There's always competitors out there willing to do it cheaper. Some competitors can be more niche focused. And so you have a constant struggle on your hands. And as we looked forward to this digital transformation, we looked at ways to isolate those two parts of the business. How can we make things easier on our customers to do business with us? And how can we make things easy on our talent or travelers to do business with us? And when we got to that part, that's where we kind of realized we had to make a change.
Okay, so if I hear your challenges correctly, so now we have a list of 10 challenges, which I'm going to say are pretty consistent from what I see. We see dated processes, right? Lack of digitization or the need to digitize, the pressure to innovate, which that's never going to go away. We just have to get used to that. Cost of disruption and understanding the cost of disruption. I think when we walk into digital transformations without knowing what that's going to be, that's where we get into trouble. Right, we have to weigh the pros and cons of the cost of disruption, and then this pressure to deliver cheaper, faster, better. How do you do that if not with the support of technology or digitization? Right. So now that we have these 10 problems to tackle, let's talk a little bit about how you broke those down. The first part of about solving for a problem is realizing you have one, right? That's the first step. But breaking it down to the ridiculous so that you have these tangible problems that you can solve for. Can you help our listeners understand how you prioritize 10 problems? You can't boil the ocean. So how did you prioritize those? And then how did you break those down to get to your most important things to tackle, like platform, like a platform, a staffing platform?
I can Candace. Go ahead and start with that.
Yes, go ahead, Candace. Yes. Sorry.
Oh, no, you're good. So what I did is I actually put a whole business systems team together, and I put a head of that business system team, and we just said, okay, this is what this department here is going to control all of our technology, all of the tools that we put in place, or the contracts. And we're going to go one by one and start looking at what does it do? What is the cost? How is it integrated into our systems? Is there more integration potentials? Does it integrate in our support side? Does it integrate? Because here's the biggest thing about it too, is when you're looking at technology or a system, it should really play into every part of your whole business. So for me, it was like, I can't even get a true line of sight of what we're doing without, right, this department coming into place, putting in control, and then the data points, right, that we can then look for the future, we can forecast. If they're under this department, and we have a head there, we can really start to identify what we need to change. And a big part of that too is when you're looking at a business systems team, to me, or a business enablement team, it's the technology, it's the automation, it's whatever you have that can plug and play, but it's also your processes, right? Like, what are you doing? So it was twofold. We had to do all of that. And that was really going to be the core foundation of how do we evaluate, how do we develop, what do we need? And then a part of it too, and I think anybody that's running a firm or a part of a staffing organization, it's very easy to get sold on technology. It is very easy to look at something shiny and say, yes, let's do this. But is it something that is functional for our organization? Is it forward thinking? Is it something that's going to survive for the future? Like Michael said, COVID really changed the atmosphere, especially I think in healthcare staffing, of how we are doing business. So that was just step one. And then it was project management, right? You're going to have to work with the sales team. You're going to have to work with our finance team. You're going to have to work with our people operations team. How do all these, and our compliance team, how do these all funnel together and play a part? Because again, that is going to speak to your internal team. That's going to speak to your clinicians, your healthcare professionals that you have out in the field. That's going to speak to your back office team with how it all flows together with payroll. So when you have 10 different problems, like you said, that is very, very hard to tackle. If you don't have an organization around it or project management, I've failed so many times in the past not having that in place. How do you leverage? What are we using? What do we need? What does it do? I mean, it's really like a scientist in a way, right? Like, what does this do? Why do we do it? Like, you're asking all of those questions, and keep it really simple. But that was how we really understood, what does our business need to get to the next level? And then that directly affected us having a lot clearer understanding of how is that impacting our bottom line with what we're spending there.
Okay. So your 5 steps, and then Michael, we're going to come to you. So I love steps because they really help our listeners break it down, so they can walk away with something tangible. So I love this, putting a steering code together, consolidating that sort of buyer process within the organization. Some call it procurement. But if you say that to a software provider, they'll probably go, but having a consolidated steering committee that has a vision is connected to what your long-term vision is, but then can practically make it happen through the application of technology. Voice the customer. So voice of the customer, meaning clinician and customer, and understanding what their desires are. The why and the buy. I think that is huge. That's what we call it at Leap, the why and the buy. Why are you buying? Because it is so easy to get shiny object syndrome, particularly when we've gone in the past 6.5 years, we've gone from about $5.2 billion in VC funding to HR tech, staffing tech, recruiting tech, call it what you will. I wish we put it all in one bucket, to almost $20 billion. So that's a lot of noise, particularly after AI. So, the why and the buy is super, super important. And then you said this, and this goes without saying, fail to plan to fail, right? You got to have a plan and have a PM, and then understanding your spend, which we've come out of 2024 hot with doing tech audits, and that's agencies, really evaluating what they're spending. Michael, Tell me, give me yours. Give me your 5.
Sure. So, again, going back to the need, the challenge was our customers want more from us, our travelers want more from us. Well, then we look at our processes. So step 1 would be, like you said, identifying that problem. Step 2 would be looking at all the processes and where can technology automate or enhance our current staff, and what can't we do? So we have a saying internally, people for relationships and technology for transactions. And so that piece was integral for our project management team or our leadership team, to say, okay, where do we want to enhance our people and those interactions and those relationships? And then what can we automate away? And then when we started talking to all the different platforms, as you mentioned, Lauren, there's a ton of VC money and what can be the latest and greatest platform out there, and what solves the healthcare staffing challenge. Because as I said, there's 2 kind of core customers for us, clients and travelers. And once you look at those 2 pieces, where you can automate and then where you need your people, we had to figure out what platform could be the least trade-off that we have to give. Like, there's a give and take in everything when you're doing a complete digital transformation, but where can you not have the most change management, and where can you make it as comfortable as possible on your people to actually implement it? Because that's another big piece, as Candace said. And once we got to that kind of framework, it was pretty clear on where the go forward strategy was at that point.
Love it. Okay, so identify the problem. We've got that. Process. Now, I love this because we see this a lot. We see agencies that are not reevaluating process when they go and they look at technology. And we say almost the same thing you do. People on relationships, technology on the repetitive, right? So same type of thing. What within that process can you either automate or remove, the hands on, right? Where can we do that within the organization? And this one I really, really love because it's a very, very real thing that goes unidentified. Change fatigue is a real thing. So when you're considering all of this, you also have to consider the change fatigue that comes with constant digital transformation. And so, is it the right time? Timing and tolerance is kind of what we say here. So I love these, very straightforward, gives our listeners something to consider. So now let's talk a little bit about how you got there and what solutions you looked at. And then I want to come back to failure because I think there is a big misconception that failure is a bad thing when it comes to technology, and it's not. It's okay to throw spaghetti at the fridge and have it flop off the fridge, but we'll come back to that. Let's go to you, Michael, first about some of the things that you looked at to help solve for this list of problems.
Sure. So obviously our problems were speed to submit, and our problems were credentialing and compliance, and our problems were cost. Why is it costing us so much to acquire talent? There's external job boards out there that we were paying an arm and a leg for. And then, what is out there? And I think when you're a novice, as I said in the top of the call, and what Candace kind of echoed too, is we were an old school agency. So I didn't spend a lot of time going to all the conferences and talking to all the platforms out there. So I was a from scratch kind of learning on the job. What is now the digital enhancements that we can make for our agency, and everything was from the beginning. So I talked to a number of different platforms. Some had a piece of it, some had, let's say there was 4 pieces I wanted to address, right? Like we just mentioned, some of them would have 2 or 3, some would have 1 really good one, and it was up to us. Like you said, you don't want to have too much change fatigue. I don't want to have a little platform for each piece here. And I had to make those assessments internally of how it could work for us. And I think that was the challenge in going to the next step, is seeing what was out there and what pieces could we pull from, or what solution would be the best to address all the pieces, which, like I said, again, for everyone here listening, we're all dealing with the same stuff. I mean, you got to do it cheaper, faster, and better. And you got to give your internal team more ability to reach more people that are closer to buying than they would be if you were doing it manually. You need a system in place that can make them qualify them for you almost. So all that in consideration, you have to figure out what blend of technology, what your technology stack would be, so that you could not only implement it, but then not drop off with your customers. And that was another big consideration, is how much time would be down not servicing our customers, and how much time would be away from our business trying to figure out how to actually implement this. So all that in consideration.
So what I heard is you're looking at vendors and you're determining how many problems can this one vendor solve for, right? I mean, the more problems that a singular vendor can solve for, the less throats we have to choke, right? Which, with all of the technology, that does become a burden that we have to think about, is how many people are we having to deal with when we're trying to solve things like speed to submit and cost and credentialing and all of this. So how many problems can they solve for that are on that list of 10 plus? And then you're looking at what is the barrier to entry? What is going to be the level of difficulty in implementing something like this? Because that disruption costs something, right? And then ongoingly, where is this technology going and how far can it take me? Is that what I heard?
Sure. Yeah. We're not experts.
Okay, sure.
We're experts in staffing, and
right.
Where can we put it together?
Excellent. All right, Candace, how about you?
So I will mimic a lot of what Michael stated. I agree completely. But again, just to highlight too, the change fatigue, and we were going through that already because we had all of these shiny objects and then everything kept changing. So what we really had to do is identify, what does compliance need? We had all those issues, speed to submit, right? Compliance issues, our healthcare professionals, right? The old school way of doing things. But we really had to understand what do our end users need? So there were tons of failures through this process. We actually learned through a lot of failures time and time and again. But what we did was we kept those failures and those trials when we identified, right? I love when you say one solution that fits multiple areas, because again, that speaks to your bottom line, it speaks to cost, it speaks to what you can control. And so those were things that we had to be really intentional about. So we created focus groups, right? Too. We put focus groups together in each one of our departments to find our champions, to find our advocates. And then we did the same as well with our clinicians, right? To really understand what those gaps are before we try to change it all at once, because you will fail time and time again if you try to change it. And then again, it goes back to change fatigue. Then you're going back to your team, changing something again. So I just looked like through the storm of everything that we were facing in 2023, especially just to get things cleaned up and put together, I couldn't fail the organization by going again, changing this, then going back to the table, changing it again. So holistically overall, that's like really what we did to try to dissect, like, what do we need to do here? What platforms are going to be a partner for us? And I think that's a big thing I should highlight. When I started looking at the vendors, we started dissecting what is their value. I've been very, very intentional about who do I want to work with. Any partnership that you have, whether it's automation technology or anywhere in your business, it should always be a win-win. And so that was a really good way for us to determine, with all these shiny objects, who are our partners in this business that know this field. They know, they're the experts, like Michael said. And I said at the beginning, we are healthcare staffing. We know the relationships. We know how to build them. That's our expertise, but we weren't experts in technology and platforms. And so when I looked at that and evaluated some of our partners, we had some really good ones. We had ones that weren't willing to add value to that relationship. And any healthy relationship, it should be a win-win. And so that was a huge determine, that's how it helped us determine who do we want to work with as well. So it's one thing to say that you can't find one solution, right? I mean, maybe someday down the road, you can't find one solution that's going to match all of your needs, right?
Right.
But if you have multiple partners, you should be very intentional. You should be very intentional about what are they trying to solve with you? Do they want to be a true partner? And do they want to make it a win-win? And if they don't, it's kind of off the table for me.
Right. Yes. Okay. So how many problems they can help you solve, barrier to entry, right? It's got to be something where we have a smooth transition in, and then we have an ongoing relationship and partnership. So that bleeds into the next one. And I think that goes undervalued often. And there's a ton of trust that comes with you knowing staffing, them knowing technology, and being able to put those two things together for the longer term roadmap for both of you. And then expertise. I love that one that you pointed out. You also did something, I think, from a change management perspective that I think we could all take, sort of a page out of. I'm a huge fan of change champions. It's a part of our whole change management process. We have a proprietary 8-week thing, we have our change champions, influencers, SMEs, whatever you want to call them. But you took it a step further, and you did that internally. That's internally, but you also did it with your clinicians, creating some of your nurses and or clinicians as experts in a specific technology. I think that could be amazing, particularly if you have multiple clinicians at one spot, at one location. How can you get adoption? Because the reason we're making these investments is for adoption. So you're taking it a step further, not just doing those subject matter experts or change champions internally, but doing it externally as well. I think that's pretty awesome and a really good piece of advice. But you talked a lot about failure. So let's talk a little bit and look, I am the CFO. I am the chief failure officer here. I want my people to fail every day, because if we're not failing, we're not trying. And so, tell us, and Candace, I'll start with you. Tell us a little bit about what you tried and what failed, before you got to kiss a lot of frogs to find your Prince technology, right? What did you go through to get to where you are today? And then I really want to hear about what's changed now that you've been able to, make this technology investment.
So I've never heard a CFO that way of Chief Failure Officer.
Chief Failure Officer.
But yeah. I love it. And that was very hard, right? Like, I think naturally your human instinct, and especially if you're coming into a newer organization, like, you know, we were more of a startup too, right? And coming into this in 2019, but so many people are scared to fail. And it's like, failure is the best thing. As long as you have a team that's willing to accept failure, right? Learn from that failure and then find a solution. That was key for us. I probably, like, you know, we'll get to this point and we'll laugh about it, but anytime you're implementing software, there's going to be failures. You can't expect it to be perfect. But what we did is we project management all of that, right? Project management is the key to your systems, processes, and put everything into place. And so what we did with those failures was we would challenge, like, our vendors. Can we work around this? Can we find a solution? And either we could or we couldn't. But at the end of the day, when you're looking at the things that maybe don't fit completely in the puzzle piece, you have to look internally as not being an expert with the platform and understand, is this like completely going to erupt if I don't have this as part of it, if it doesn't quite fit exactly how I want it to fit? Or what is my true solution? What am I trying to get to? So that's where failure, like, we had failure after failure after failure. And the beauty was always within failure. And I say that to my team. I'm like, look at this personally, professionally. In every moment you have a failure, there is a beauty that lies within, and you will find it. And so we always just look, where is something in here that we can learn? What do we need to implement? What do we need to change? And so that was a huge part of this experiment. Like, and it will continue to happen. Like, anytime you're implementing, anytime you are setting even your potential new partner up, right? It has to be a win-win by thinking an implementation or any tech experience is not going to have failures. That is just bottom line. You have to wrap your head around that. And I can be a very big perfectionist. Like, you know, we'll talk about this with Praos. I'm not that easy. Like, I want what is best for our organization and I want what is best for our team. But getting what is best, you will find when you fail. So you cannot expect them to be perfect. You have to be very transparent. You have to get vulnerable. You have to be direct. Because if our partner or our vendor isn't willing to listen, we're not willing to take accountability on our side of maybe where we didn't communicate correctly or we didn't put it together, then that's, again, not a healthy relationship for any implementation, any solution to really blossom from there.
Okay, so clear expectations, accountability, and communication. I mean, isn't that foundational for any relationship, right?
It's foundational, but it's surprising, like, how hard it is for, you know, people to feel comfortable to do that. And I think whoever's championing it, you have to get vulnerable enough to talk about that and be leading it. Otherwise, the rest of your team isn't going to adapt to that either.
Michael, let's talk a little bit about what you tried, what didn't work. Let's talk about failure for you and how that impacted where you are today.
I think when you embark upon a digital transformation of your business, you just don't know what you don't know sometimes. So experience is the best teacher. And where we failed originally with some of our initial investments in the space was we just didn't know the right questions to ask. And we didn't have like as Candace said, we didn't have that trust built with either the implementation team or the service after the sale, where they would come in and kind of coach us on best practices, because it was new for us. As we said, we were BC, we were an old school agency before COVID, and we had to adapt really quickly. So understanding what the platform will do for you once implemented, like how they can coach you and if they can share best practices with their customers that are doing well. And I just felt like I never asked those questions up front. Again, just lack of experience, some naivete, but I think that was a big failure for us from the get-go. And something that we looked for when making a more significant investment in the future was vetting our vendor, our partners out like that. Just like, hey, how are you going to help me get better once I implement? And how are you guys going to get me from, if we're going 0 to 100, once I implement it, I'm at 1. So let's talk about getting from 2 to 100. And what can you do for me in terms of weekly or monthly cadence calls and best practices and things of that nature.
I will often say to the people that we advise is if a vendor that you are considering cannot tell you what metric that they move, run. Run fast, run away, run as far away as you can get, because there needs to be clarity of the metric that they're going to help you move. And you said it quite eloquently, right? Failure happens when we don't understand our requirements, right? What does the business require? Functionally, process-wise, what does the business require? What are the best practices with the technology that you're choosing? And that often happens when we're going from a legacy system, trying something new, and we're trying to take legacy system and jam it into new tool. And so understanding best practices and the tools that you're going to be leveraging is foundational. And then understanding the new differentiators. I think that is really key too. What is this new world going to bring to you? And how are you going to sell that? And how are you going to, if you have a really cool opportunity, once you do a digital transformation, to be able to evangelize that externally to your clinicians and to your customers, that is often not realized properly. You can get a year of good marketing out of a big technology investment. And that's often overlooked because we're not looking at, that's where failure happens. We're not looking at the new key differentiators and how this is making you better, faster, stronger, how it's setting you apart from your competitors, what these new investments mean to clinicians and customers. So it is a huge area of failure when we don't have clarity there. I love this. It's amazing. Okay, so now we have all the problems. We have some of the failure. We have the process to get there. So now let's talk a little bit about what this has brought, what new world you're in now that you have this new platform, what it's offering to the organization, what some of the results have been in making a decision like this to invest in a large digital transformation like a platform. And that's sort of redefining your business and what the experience is going to be. So Michael, I'll start with you this time. What have some of the results been? I'm excited to hear that.
Sure. Yeah. Well, this is like so corny of me to say. Maybe there's some folks like me like this, but I like to be like go on Zillow randomly and just look at houses and just see,
sure.
Like what's out there. Oh, that mansion looks pretty cool. Or that beachfront, like one day. But I say that kind of tongue in cheek because when we got to the point where we realized the buying process of our service or the using of our service had changed, when we got when we realized that our customers, our candidates were buying differently, it wasn't just waiting for a call from me, their recruiter. It was, hey, I want to proactively look at my next job, why I'm on assignment currently. They wanted to Zillowize. I just made that up.
Love it.
There you go. They wanted to shop, Amazon, Zillow, whatever it is. They wanted to shop before they bought. And I think that was the biggest mindset shift for us, was realizing our customers' preferences have changed. They want to know where their next assignment is. They don't want to have to go call a recruiter who they feel sometimes is gatekeeping them from the job. They want to look, they want to see what the radar is. They want pay transparency. They don't want to have to negotiate with the recruiter sometimes. So when I realized that the world is changing and that these platforms are giving our travelers power back in their hands, and they feel empowered. Well, I just got to, I got to give them what they want. And they wanted more jobs to look at. They wanted a recruiter when they needed it. It goes back to what we said at the top of the call: people for relationships, technology for transactions. You don't need a recruiter to go through all 200 jobs you have in Atlanta or New York. That's what the digital app can do for you. And so that was one of the big things. Like my realization was, like, what I got from it was like, all right, I have to transform, but I also got to do it for my customers. My customers want certain and different things that I currently don't have right now. And so, and there was other things where, look, again, using Zillow, you kind of like, this house is now pending, but you might be interested in this house. Like those kind of job matching or that automation function of like, hey, one door's closed, but another one's open type situation here. That is another thing that our travelers wanted. They wanted to be kept in the loop of like what was opening and closing, because they get frustrated when they apply for a job and then they don't hear back. Our recruiters are incentivized to do certain activities. So in short, that was a big takeaway for us. It's kind of moving into the 2023 and 2024 year of helping our customers buy easier, reducing the friction.
So you've got some cool things there, because post-COVID world, and Heather McGowan actually put out a couple studies about this, that post-COVID, things have changed with our workers, right, and our workforce, and it's no longer that we turned into consumers. So consumerism has now come into the job seeking market. What that means is we got really good at being in control when we were at home, right? And there was a lot of control that was a little bit lost when, with jobs going away and what have you. And so transparency, control of the experience, and then that sort of recommendation. What's the next step? Where am I going next? Particularly when we've got three different generations in the workforce right now, it's really, really important that we meet each generation where they are. And so the what's happening next, that transparency and the control, that's the consumerism that's now entered into the job market. If we're not providing those things, they will find it elsewhere. Really, really good key results that I think are, in the post-COVID era. Candace, what have you found in making these new changes?
I do want to say I agree with Michael said too. So there are some ones that really stick out for me. I'll start with the clinician experience, right? Having that mobile application, having the ability that they can upload, their credentialing right into the platform, they can house it. I mean, it speaks novels for what they can do. And if you haven't done a demo, you should do a demo. It was a game changer for me. But that experience for them, like I said, we were behind the ball with the transformation, digital transformation and the technology. That's not my expertise. But then we found a partner who had that expertise, and it paid off with our clinician experience, right from the beginning of launch. And then the metrics, right? The results of the metrics and what we had visuals too. We had a competitor go in and actually do a fake profile, and literally was blown away that our recruiter responded in a matter of 2 minutes once we went live. I was like, this is amazing. I mean, just to say, like, everybody, and if you think of yourself, you want somebody to have that much value in you, right? You're doing something, right, intentional, you're applying, and for somebody to reach out in 2 minutes, it's like, that's customer service to me. So we could really start diving in. The results that we got was diving into metrics, like you said, that matter, right? Matter to the clinician, but then matter internally to us, to how do we hold our team accountable for the experience that we want, and right, our core values, like what is Marble? We want to be the best. And so that was a huge result. We had not only engagement for new clinicians coming in, but we re-engaged our whole database. So we literally had, I mean, I won't give the total amount of placements that we did, because we got some more. I was telling David, we have some more identifying to do, like, because I don't want to sell that as like, hey, this was an immediate, but I was shocked to see the engagement from our whole database, because I know anybody here that has a staffing agency, there are candidates in our platforms that are just probably waiting to get engaged, and it sparked a new interest, right? Like, this was a new field for us. We were not old school anymore. So I think that sparked a lot of interest for our clinicians already in our database. And then huge for me, a direct bottom line expense management, right? We cut so many expenses because we found one tool that fixed probably, I think, 3 to 5 other tools that we were like, I think 3 for sure, a couple more that we could just cut out, that we weren't utilizing efficiently, that this one platform would take and do better for us. So everybody right now speaking about their bottom line, we should always be invested in like, what is hitting our bottom line, and it freed up a lot more decisions for us to maybe add on additional tools, or even work with that platform to do bigger things for the future. But our direct line, our direct bottom line expense management was a huge result from going live with the platform.
Well, so I love this, right? And we know that the data is behind going mobile, right? We know that over 90% of job seekers are doing so on their mobile device. So if we're not going mobile or providing a mobile experience, we're already behind. Response time. And I think, that's where the money is right now, is because people are expecting an immediate response. They are used to going onto a transactional website and getting either a bot to respond to them or a person to respond to them. And so there is this expectation that I will get a response. I love the database utilization because, quite frankly, we've never been really good at this in regardless of vertical. We've never really been good at database utilization. You've got large enterprise firms that some of the numbers are database utilization responses at 30%. So 3 out of 10, we're responding to and are working with more than one time, and that's terrible, particularly in healthcare, where we have such shortages from a skill perspective. And then the idea of expense management, being able to do away with tech bloat, that's the nirvana for all of us, right? To not have any wasted spend, to make sure that we, get every little morsel of ROI that we can get out of the investments that we make, because your technology investments are the second largest investment that an agency will ever make, second only to your first and most important investment, which is your people. And so, we've got to put the time and energy into making it work. So fantastic. Okay, so now I only left 8 minutes for our listeners to ask questions. So I'm going to be monitoring the questions here. I want to give them the opportunity to ask any questions of our experts here. So if you have questions, please put them in the Q&A or put them in the chat so that I can ask them. And I'll give you just a second to do so. Okay. Okay, so one of the questions is, how long did it take you? How long did it take you to make this transformation? Go ahead, Candace, you go first.
I will start. I was not easy. Like I said, it took longer, but that's what really goes to say on who are the partners you're working with. But we had internally had to take a lot of accountability of our processes were all over the place. I think we had, almost 20 different statuses with certain, and it's like, that is not simple at all. And so we had to work with them. But it took total for us over the whole process, which we were going through a lot of change management internally. It took probably about 6 months total. Now, I'm sure Michael, I think, probably had a quicker experience. Well, I'm not for sure, but part of that too was because of our team. Now, what was phenomenal, and I will say, because like I said, I was not an easy sell. Most every integration that we had, it was like, this is going to be 3 months. This is going to be 6 months. The team at Praos, how quick they integrated into our ATS, I've never experienced. Like, I was blown away. I was like, who are these people? Like, it was amazing because you get over promised all the time and it's under delivered. So it was pretty phenomenal to see what they could do.
6 months is pretty incredible. Michael, how about you?
Yeah, and I would kind of the question about how long it take us. You can get stages done. You can get depending on what you're looking for. I think for us in our circumstance, we didn't have a job board. We didn't have a job board. We didn't have a mobile app, and we were using Bullhorn. So they were like, to Candace's point, like, all right, we'll get you synced up with Bullhorn immediately, basically, and then it's all about how much your current database can then be pushed into Praos' briefcase. And that was, we had like overnight, it was like 400 people sign up. And then we would go back and educate them on why they wanted the briefcase and the value to them. And so that took time. So from soup to nuts, it may have been 6 months by the time all of our folks were compliant. But you're always adding. It's an evolution, not a revolution. So it took time, but you're getting, it's like a flywheel. Each spin gets more and more easier. So it's like that first spin might be tough. You don't see a ton of results, but then all of a sudden things are starting to compound on one another. So I didn't put a clock on it, but I just know that you could get wins along the way. So it felt like rewarding.
Yeah, and I think the point is you don't have to eat the elephant. You can pick some of the things that are going to be quick wins. That's what we do with our digital transformation exercises is what's a quick win, what's a longer term investment, and what's a much longer term investment, like redesigning a back office or something like that, an ERP project. We know that's going to be big, right? So how do we get the quick wins, and prioritize from there? We have a great question, Brian. And I'm sorry I'm saying names. Brian, how do you communicate with internal and external team members, all three parties within the platform?
I can start with that. So, or go ahead, Michael, you go first on this one.
I don't know if I understand the question, so I'll let you answer, and then I'll answer if I figure it out.
Yeah. So, that is a difficult, and I do see here or there, I think, Lauren, there's a additional to that, or there's still, items that fall outside of, absolutely, there's still items that are going to fall outside of those platforms, right, for communication.
Sure.
When you think about it internally, we have different platforms that we're going to use to speak to one another within our infrastructure of our organization. Externally, they're going to function a little different. The key is that they should fall under your ATS that you're utilizing, right? So you can gauge and understand, especially to our external, right? That's where you can really identify and find data, right, from those, and truly drive, like, what are they doing? But internally, for this platform to speak internally, that wouldn't make sense with what that's trying, what we're trying to accomplish there. So I hope that answers the question. But it eliminated a lot of what our clinicians were doing as far as communicating with our team, which was key, right? They had one platform to come in to look at jobs. They had one platform to fill out their compliance, upload their compliance, versus this external communication through email, through phone calls, through text. It could all fall under that platform.
Excellent. Okay, fantastic. So then we've got another one that, did you do away with Bullhorn? And then Maria came in and said, no, the platform integrates with Bullhorn, which is, I think, what both of you did, correct?
Yeah.
Correct.
And so, and I would just say too, like, how long, like these questions, exactly what my mindset was when I first started going through this process, like, how long is it going to take? Well, where can I replace things? You have to kind of change the mindset in terms of, like, Bullhorn will sit as your ATS/CRM. And then, to Candace's point, Praos will handle the communication with your travelers and the credentialing and compliance piece, and then the re-engagement of the piece. So it's a re-engagement of the traveler. So like we talked about, they're sitting dormant in Bullhorn. It can do like job matching and things of that nature, so to keep them warm for you. But you wouldn't like communicate with your recruiters with Praos. Everything kind of sits on top of Bullhorn or adjacent to Bullhorn. And how I look at it, again, there's different flavors to this, so this is just my experience of it. But I think it's like a mindset shift of, like, I'm going to add this to reap the benefits of a healthcare specific credentialing, compliance, and staffing and job placement platform.
And I will just touch on that, if that's okay. The beauty of it integrating into our ATS Bullhorn, which means we could develop metrics and data points outside of, like, right with what they're doing into Bullhorn, because they're still working out of Bullhorn internally. But because it integrates into Bullhorn, we can really identify what is our team doing to make them better. So Michael said it well, but absolutely not. Bullhorn is our ATS. That's where we want to work out of. And that's why this platform was beautiful, is because we could work out of that one platform and track all of that, versus our team going outside of our ATS to do things.
I want you to be in your central source of truth. Okay, this has been an awesome conversation. Candace, thank you so much. Michael, thank you so much. Thank you to the Praos team for allowing us this opportunity to put together this fireside chat, and hopefully we've done a good job of educating our listeners. This has been recorded. We will send out the recording, and so I thank both of you for being here, and thank you to the Praos team for having us. Thanks all.
Thank you.
Thank you all.